Hi, welcome to my channel. This is Bobbie Jenke in Santa Rosa, California. I have not brushed my teeth yet this morning, and I ate blueberries, sorry. Uh-oh. Anyway, so much for being live. I've survived through the winter. It was really rough. It's, the date today is what, April the 20th yet? Almost. Trying to figure it out. The 19th maybe. 2025. I had a rough winter, rough time. I was supposed to go in for a test last week, and I just couldn't make it. There are days I wake up, I never have restorative sleep because I don't breathe at night. My diaphragm was paralyzed in 2004, and my first rib was cut out entirely, called a thoracic outlet surgery. Very unorthodox and very criminal, actually. This was assault. And all my scalenes were cut out, and so you can see the huge depression. Everything's scarred down. It pulls my neck down to the ground every day. My spine, it's very kyphotic in the upper thoracic, very kyphotic, and then lordotic in the cervical, and the juncture is not very good back there. So I have trouble walking. Limited use of my arms and shoulders. Sitting at a computer is very hard. Vision is beginning to be severely affected. There's a retina problem now. They seem to have gotten the tumor with just 10 rounds of radiation, of conventional palliative radiation, which is like fractionated 30 grays, I guess, in total. I don't know. I have to review that record. But apparently they think there maybe was some abscopal effect, but I think actually the cancer is still there, and or cachexia response, because I had lost over 5% of my body weight prior to any treatment. So actually prior to any treatment. Almost prior to diagnosis. So and the cancer radiation, pelvic radiation, which was done in July 2021, affected, and the cancer itself, I think before that, was starting to affect my heel pads. My heels were getting cracked and feeling puffy like the Pillsbury Doughboy, like a marshmallow. And after the radiation, oh my God, I developed a rash, an itchy rash all over my entire body. My trunk, not the chest and not the back, not like dermatomyositis, but I did have it biopsied finally. It was Lichinoid Interface Dermatitis, so it was an autoimmune type response to that huge invasion of the radiation and the cancer itself. And I told them my heel pads they're cracking and they were puffy. I have pictures of them, and they were coated. They just looked horrid, and I could barely step on my heels, and they were going to like crack all the way through. And I saw a podiatrist, and he said, "You're losing your heel fat pads." And literally I was. I can feel they're not there when I stand. I mean, I can still stand and walk, but not very far. This shoulders rolling forward. I think the cachexia affected the surgical site even worse. And losing anything in this, any collagen, any tendons, any muscle, any fat in this surgical site, which is already so damaged, is devastating for me. And it's even during the radiation, I told the oncologist, I said, the radiation oncologist, I said, my neck is being pulled tighter and tighter and tighter. Well, clearly I was off of the HRT. I'd been on HRT for 15 years, which was prescribed, but not monitored. So that had been the cause of the tumor growth. But all of a sudden I had to get off it, right? And so also you have estrogen receptors all over your body, and it used to help soften this a little bit, but I had lost the estrogen too, and so that sort of makes collagen and ligaments a little bit not as flexible, maybe not as I forget the word for it. You know how women use estrogen for dryness? Well, I think things dry up, even tendons that connect your neck and stuff. If you don't have estrogen anymore, those tend to dry up, and it's been devastating for me to live with this for this long. And I'm getting very little breath because of the paralyzed diaphragm and the compromised airway. This is really compromised. In here is your, you got your trachea, your esophagus and your trachea, and it's little tiny breaths at night. With my mouth open is all I can do. And I'm sleep deprived. It's been really rough. That's why I had to cancel the appointment. I could not get enough sleep, and I'm hypoxic at night. I've got to get some help for this. So that's where I'm at right now. I don't know how much longer I'll live. I really don't. You can't. Hypoxia is terrible for the body, terrible for the brain, terrible for pain, terrible for cancer, terrible for... And my mouth is totally dry, because I'm breathing through my mouth and no saliva, and I'm having dental caries starting to form, and old root canals hurting, and I can't sit in a dental chair with half a neck. Have you ever tried that? With your mouth open? Because even talking affects all of these muscles. Okay, enough said for today. I'll stop it there. Thank you for listening, and have a good Easter, and good holiday, and good Passover. Bye-bye.